things that can occur in the back of an ambulance is standing up and being unrestrained without any seatbelts on. And Maurice is now standing up and Lily is taking off her seatbelts. And so Maurice, he's doing what he's supposed to be doing and is trying to keep the patient restrained, but he's not a paramedic, so he can't sedate her with drugs like Valium or Ativan or Haldol or ketamine or whatever anybody might be using to sedate patients. He doesn't have that ability, and there's really nothing that he can do other than to try to keep the patient restrained. And so she keeps taking off her seatbelts, and he's trying to hold her on the stretcher, and Lily sits up and actually takes some swings at him a little bit and is trying to get out of the stretcher and eventually ends up off the stretcher and over in Sergeant Pelayo's lap on the bench seat. But the reason why I want to play it over so that you can see where his hands are on her leg, because in a moment, Maurice is going to be arrested. And the justification that Pelayo used, or at least one of them, to place him under arrest, is that he battered this patient by touching her and hurting her leg after she had removed consents. Geez, what a terrible situation. And regardless of what anybody thinks, okay, Lily is still the patient here. And she did apparently just suffer a sexual assault earlier. And so maybe Lily's behavior is expected. I'm not saying that it's acceptable for Lily to be kicking and swinging. And I'm not saying that it's right for somebody to make those decisions, as an adult. But out in the EMS world, paramedics and EMTs deal with behavioral and psychological emergencies every single day. So do nurses and physicians.